Welcome back to another season of Business Highlight. My name is Pedro Heizer. I am the managing editor of the Boca Raton Tribune. And on Business Highlight, we talk all about local businesses and how these businesses help everyone in the community every single day. And so let's just get started right off the bat in the season 2. I have the privilege of having Roshini Singh with me today from Direct Primary Care. Roshini, how are you doing?
Hey, Pedro. Thanks for having me. I'm doing well. I'm excited to be here.
Yeah, nice to see you. I know that you're new at the practice.
Yes.
So I thought it'd be great to have you on the show and just talk a little about yourself and the practice and everything in between.
Yes.
So yeah, it's awesome. So before we get started, tell me a little bit about yourself, for the viewers that don't know who you are, and tell us about you.
Okay, great. By the way, if you hear a 6-month-old screaming in the background, that's my kid.
Definitely not mine.
Yeah. So, as you know, my name is Roshini Singh. I'm a family nurse practitioner, board certified. I've been in the medical field for about 10 years. Well, actually a little bit more than 10 years. And I've been specializing mainly in primary care and family medicine. So
nice.
Yeah.
So where did you receive your training for this?
I went to Florida Atlantic University in Boca.
Go Owls.
And go Owls. I love my owls. I have like teddy bears with owls. I'm just obsessed with them.
Have you been living here locally for a while?
Yeah, I lived in Boca for about 10 years or so, and then moved to Boynton Beach after I got married. So
that's still in the area.
Yeah,
it's still it's like 20 minutes away. It's the same thing. So awesome. So I know that you're new at Direct Primary Care. But for the people that don't know what Direct Primary Care is, why don't you go ahead and explain a little bit about what you guys do over there for us?
Yes, gladly. So there's a lot of differences between the traditional insurance practice. The first thing about Direct Primary Care is that it's direct access to your provider, really. You don't go through a couple people to get to your provider. You have health concerns or questions. You can message us via text, email, call, virtual or video appointments, in-person visits. So there's many means of communication to get to us directly and quickly to answer your healthcare needs. So that's one thing about us. The second thing is transparent pricing. So it's a monthly membership for service. You're paying a flat fee to have all these primary care services included and unlimited visits. So there's no extra copays. You're just paying your monthly membership service to have unlimited access to us. And then the other thing, thirdly, is that we're not dictated by insurance. So we don't deal with insurance companies. So let's say you're a patient, you're a female, and you want to get your physical exam done and a pap smear in one visit, you can, because we're not dictated by insurance and their billing. In traditional insurance practices, unfortunately, due to the time and the billing, sometimes patients will have to come in separately for a sick visit or separately for a women's exam and then separate for physical, depending on how the practice runs. So with us, we had the time to do all of this in one, if you wanted to have that option, which is nice. So, it saves people time from work and their family and everything.
Yeah, guys, we're
Yeah.
talking to Roshini Singh from Direct Primary Care. Their phone number, if you're interested in reaching out to them and learning more about their practice, is 561-530-2622. Sorry. And their address is right there on the screen as well, to 801 Meadows Road, Suite 111, right across the street from Boca Regional. If you guys don't know what that is exactly. I'm not gonna lie, Roshini, I am a member and I love it.
Oh,
So yeah, I love it. I love what you're talking about. You're saying, oh, it's easy. You can just reach out to it through text. I'm like, yep, that's what I do it. Go, hey, I need this, and everything's working. It's great. It's awesome. But tell me why you decided to join this practice.
so definitely for those reasons above, and mainly because I get to spend more time with the patient. I mean, I'm sure a lot of providers agree that if you were to spend more time with the patient, then you can have more effective treatment plans and
Yeah.
hence more improved healthcare outcomes. You know, a lot of times, like patients leave the office and don't remember half the things of what you recommended. And I feel with this model, it's true.
So true.
It's true. I mean, I feel like with this model, because we have the time to really explain to them why we recommend certain things, they're more inclined to remember. So I just feel like this is the best way possible to practice medicine. We have a saying that we like to say in the office, and it's modern medicine with old school compassion. And every word is true to what direct primary care does, you know?
Wow, I like that. What was it? Modern medicine with old school practice.
Oh, I said it wrong. Oh, old school compassion.
Old school compassion. That's awesome. No, that's a
Yeah.
great motto. That should be like bannered
Yeah.
anywhere. I love
Yeah.
it. And I think a question that people might be asking, right, would if they're watching this right now, it's just, okay, what's the difference between a direct primary care than my guy that I go to with my insurance? So if you could I guess it's not really. I guess it's easy, but not really. If you can explain the main differences between a regular primary physician and direct primary care, what will those differences be?
Well, yeah, it is pretty easy to differentiate. So the first thing is that we don't go through insurance. So as I said before, you could have longer visits with your provider and do
Mm-hmm.
physical exam, pelvic. You can do a lot in one visit, and you're not dictated too much by a time slot.
Got it.
We book your appointment. You're the only one that comes in. For that appointment, usually you're not waiting in a room full of other patients, which is nice for the pandemic right now, actually.
Mm-hmm.
And there's no waiting room time. So we have a waiting room, but it's really a non-waiting room because you're not really waiting there. So you get back quickly, you can spend more time with us. You have direct access to your providers. You're not going through a couple of people to answer your healthcare needs. You're getting through to us fairly quickly via text, which we have a HIPAA secured app that patients could feel very comfortable texting a picture, or we video call through the app. So the means of communication is definitely more than your traditional insurance practice.
Yeah.
However, there may be traditional insurance practices that have these communication methods, but the point of ours is that you have a more direct access to us, which I don't
Mm-hmm.
think the traditional practice may have that because of the
Right.
time and whatnot. For our members, we have, discounted lab costs for our non-insured patients. If you're insured and you join the practice, we'll bill it through the insurance. But like, for instance, an annual physical set of labs would be like $50 typically, which is really inexpensive.
Wow. Yeah.
We're able to negotiate with these labs to get that pricing. So sometimes our insured patients will just be like, I'll pay cash and just get the labs done instead of putting it through insurance.
Mm-hmm.
So yeah,
Wow.
I would say, yeah, those are the main differences. Oh, and
That's
the
good.
transparent pricing, it's a monthly membership service.
Yeah.
So
So
unlimited
what?
visits.
Yeah. So what does the pricing look like for direct primary care?
So for adults, it starts at $65 a month,
Mm-hmm.
and it goes based on age, but starting at $65 a month, which is pretty good.
Oh yeah, for sure. Especially for all those things they've been talking about, and $65, starting at $65 a month, it's great. Again, guys, talking to Roshini Singh from Direct Primary Care. If you're interested in their services, you can reach out to them via phone number at 561-530-2622, or just visit them directly, but probably call them first. So you're talking to me about how you guys how your clients don't even have to wait in the waiting room. So if you could walk me through, let's say I go in for a visit, walk me through what that would look like as a patient's walking into the clinic.
Okay, so Pedro, picture this. So imagine in your head You're walking through a waiting room with warm lighting and instrumental music in the background. There's snacks and coffee waiting for you. There's bottled water, not just bottled water, there's sparkling water as well.
Is this heaven? Is this heaven?
Huh?
I'm so confused. Is this heaven? Because it sounds amazing right now.
There's comfortable chairs, and a lot of times patients will be waiting for like a minute or a couple minutes maximum. As I said, like, we booked your appointment, so we expect you. We know you're coming. You're the only person there, so we're ready for you to take you back to the office. And so what I'll do personally is take you to my office, which has couches. So you'll sit down, you'll relax, and we'll talk about life and your healthcare needs, more importantly, and have that time. And then after I'm finished with that, after you kind of ease into the practice, then we'll go over to the exam room, take your blood pressure. Usually blood pressure is a little bit better. I don't like to take the blood pressure right at the beginning of the visit, because
those are the worst. Yeah.
Yeah, they're like rushing to get to the appointment. And a lot of patients have this syndrome called white coats, and as soon as they enter a medical office, they're like, the blood pressure goes up. So
guilty as charged.
You too. So yeah, we'll have patients take their blood pressures at home sometimes to see like the accurate level, but like it's better to have them ease in, and then I'll do the vital signs and do your physical exam or whatever else you need to be done, like lab drops or EKGs, depending on what you complain of or what you're coming in for.
I guess
that's what it would look like.
So I guess that's a good segue to what type of procedures you guys can do in office, because I know you said you guys have different people that you can send out to different medical doctors, but what kind of things can you guys do in on site?
So it's just like a traditional insurance practice. So we would offer similar stuff, like, of course, your pap smears, pelvic exams, lab draws on site, EKGs, incision and drainages of skin abscesses, ear lavage to clean cerumen out. Yeah, those are like the most common. Spirometry testing, like lung functioning testing. Yeah, like the main stuff.
Right.
That type of stuff. Yeah.
I think we were talking off air. One of the cool things that we talked about is how you guys have medication on site for the patients. Like, how does that work?
Oh, yes. So that's one of the things we love, to boast about in our practice. We do have a dispensary on site. So it's not a pharmacy, it's a dispensary where we get wholesale pricing for medications. And the medications we carry are the most common types of meds for chronic conditions like cholesterol, high blood pressure, diabetes, which are very common in the primary care setting. And then we'll have medications for acute reasons. So let's say you need an antibiotic, you can get it right there. You don't need to go to the pharmacy and make that extra stop and waste extra time. But if you do, we can call it into there, no problem. It's a nice convenience factor for patients who are like taking off from work. They get everything in one visit. You're done, you go back to work, so it's nice for sure.
Yeah, it's cool.
Yeah.
So you guys obviously been working throughout the whole COVID-19 pandemic. What kind of things have you seen differently in these last couple of months, which now is not a couple, now it's like a lot, but what have you seen differently in these months that before this whole COVID thing started didn't exist?
Well, definitely we've been seeing more virtual appointments, of course. So a lot of patients are opting more to have telemedicine visits, which before the pandemic, we actually had a platform set up very easily for that. So to transition to virtual appointments was actually seamless. And then you have some patients that will come in and will take all the precautions. You enter the office, you have to wear a mask. We wear our PPE. We wipe down and sanitize each room. And, it's just becoming such a common thing. It's like second nature, like, to do this stuff. And it's going to continue definitely for a long time, just to reassure our patients. We're going to continue to take the best precautions we can and follow CDC guidelines as for as long as possible. So
what are some of the things that direct primary care themselves are doing to help out the community during this COVID pandemic?
Well, I would say indirectly, we're keeping patients out of the ER because, you're getting direct access to your providers. So if you're getting direct access to your providers, you're getting quicker responses to your healthcare needs. Primary care is about preventative medicine and preventing you from getting potentially worse. So if you can
Mm,
get through to your provider quicker, then, we probably reduce the problem or resolve the problem quickly where they don't go to the ER. So we're not bombarding our fellow nurses and physicians and other providers in the
yeah.
hospital. So that's one thing. Um, Two, unfortunately, a lot of patients may have lost their jobs
Hmm.
due to the pandemic and hence lost their insurance coverage. So we're a really good option. And I feel like that's what we're offering to the community, affordable monthly uh, pricing for
Yeah.
primary care services. So it's
Sure.
great for that clientele.
That's awesome. Yeah, for sure. Are
Yeah.
you guys doing the antibody and all those kind of tests there as well, or are you guys sending it out to somewhere else?
Yeah, so we're definitely doing the COVID antibody test for anyone that's interested. Unfortunately, we don't have the COVID test to, in other words, check if you currently have the
Hmm.
coronavirus infection because the labs, they're not, well, understandably so, they're not supplying us with it,
Yeah.
maybe due to the supply and demand, of course. But yes, for sure, the antibodies. And if patients do ask about it, we do have the resources to tell them, hey, you can go to this drive-through and, here's the information.
Okay.
Yeah,
Cool.
so.
So moving away from COVID talk, because it's what everyone talks about now, anyways.
Yeah.
But if a patient comes in to you guys and they need some specialty type of care, how would your office handle that?
So we are primary care. So of course, if a patient needs more specialist consultation on board for the improvement of their health condition, which sometimes they do need it, we have a network of specialists that we love and trust, and we would like to refer to. And
Mhm.
actually, some of those specialists do offer DPC members a better price.
Oh wow.
So we try to like constantly obtain relationships with specialists to have this for our members. So we're always out there
Mm.
trying to market, trying to talk to specialists. What can you do? So we're that's a continuous process that we do in the office.
No. Again, guys, talking to Roshini Singh from Direct Primary Care. For more information on their practice, you can call them at 561-530-2622. Roshini, if you had to tell a potential patient or client that would be interested in joining Direct Primary Care, what would be some of the things you would try to tell them on?
Well, to give you the down and dirty summary,
Yeah.
basically, so if you're looking for high quality care with direct access to your provider, with many communication means, no waiting room times, you're the only person in the waiting room.
Hmm.
We spend a lot of time with you to get to know you. You're like family to us, to provide better treatment plans and more effective healthcare outcomes. Then we're your people. You can definitely call us and we'll answer any questions you have. There's no obligation to sign up if you call, of course. There's no registration fees, actually. I didn't mention that to you, Pedro.
Wow.
So yeah, you can join, you just clean cut, pay your monthly membership and done. You're accessed immediately. By the way, to enroll in our website, it's very easy. We don't ask you about pre-existing conditions or anything. It's very quick, basic information to get in.
What's your website? I guess you haven't mentioned your website at all.
Oh yes, it's dpcboca.com.
dpcboca.com. So yes, if you're interested in
Yeah.
definitely checking out
Yeah.
dpcboca.com. That'd be great. Before I let you go, I asked this. I was asking these questions a lot last season, and so I'm gonna keep going because people love answering these questions. If you had to give some advice, but I guess since you're in the medical industry, I'm gonna adjust it to you. If you had something to give advice to someone looking into joining the medical profession, especially in these times right now, what would that advice to that person be?
Well, I think that you have to love the medical field. If you love the medical field, then it's a no-brainer. You want to help people, you want to improve their health, and especially now, if you have that heart and compassion to really help the situation right now and improve people's healthcare outcomes, then yeah, you should get into it. It's an amazing feel. It just, you feel good about what you're doing. Of course, there's going to be times where you're sad and you're upset at yourself for doing certain
Mhm.
things that patient outcomes didn't work out the way you wanted to. It's not always perfect, but for the most part, it's an extremely rewarding career. I love what I do. Like I'm so glad I chose this field. Like when I was younger, my parents were like, you want to do teaching or you want to go into the medical field? They actually helped me decide what to
Oh,
do. And I'm so glad they did.
That's awesome. Well,
Yeah.
Roshini, thank you so much for your time. I think a lot of people learned a lot more about what direct primary care does.
Yeah.
And learn a little bit about you as well, because you're new to the company as well.
Yeah.
So thank you so much for coming on the show again, guys. Talking to Roshini Singh from Direct Primary Care. Reach out to them to their phone number 561-530-2622 or their website dpcboca.com. Thank you so much for your time. I really appreciate it.
Thanks so much for having me, and thank you for being a member. We appreciate that.
Yeah, for sure. All right, guys, I think that'll wrap up the first episode of the new season of Business Highlight. As always, make sure to follow us on social media on Facebook, Twitter, Instagram, YouTube, and all those other social medias as well. If you have any comments or interesting comments from the show, please put them below. And if you found this useful, share it with your friends, share it with your family members. And thank you so much for tuning in, and we'll be back next week. Have a great weekend.